Isn't that sort of the main diabetes headline for almost anything?
Yeah.
It's like, I think it's so good to have that like candid conversation of like, yes, you can, but let's like really make sure that we're committing to something that we say, hey, yeah, this still is risky, and like pregnancy in general it is the magic of nature. You're growing a human inside of you, but it's major surgery and you have to take time off work and your body has to recover and heal. And that's don't even doesn't take into account the diabetes. So, it just takes more work. And I think there's a lot of classifications, I think in particular like high risk pregnancy, which cause a lot more fear. And I think, listening to what you're saying, yes, that's true. It is higher risk than average, but you live with diabetes. And so you kind of have to, everything that we do is high risk. That's why they ask if we have diabetes when we want to go scuba diving or snorkeling, like that
But this
there's
is
just
different.
inherent risks.
This is different, Rob. I don't know why, but even the way you describe it, and I'm sorry, it's not to say that you're mansplaining pregnancy, but you're just like, oh, it's just like a high. I'm just like, dude, this is carnage. I feel like I said that in our last episode, but it is straight up horror movie, scary stuff, which I know we're not supposed to be scared and it's not supposed to be overwhelming. But to me, to fear something and respect it is still okay, because that's how I feel about pregnancy. Do I fear it? Yes. And do I also absolutely respect it? Yeah. So it's like, take our hats off to women with diabetes who have done this, because it seems like you're taking on a lot, and it is a very long mission, right, of staying in that healthy zone, not just for yourself but also for your baby.
And I
Yeah.
think I think too, like the misinformation and the stigma from years and years ago, like pregnancy and diabetes was one of the original stigmas around type 1. And like to see the amazing women, like you're saying, who have had families and generations of families with type 1, uh, even without CGM, or even without hybrid closed loop, or even without insulin pumps, or even without the modern insulins that we
On
know today.
Humulin, on like
Right.
Anna, on Dawn's last episode when she told us that she was on Humulin. So I want to go back. I want to ask a specific question, because it's just how my brain works. You said the most important thing is to basically get ready, talk to your doctor, prepare for this. Say I'm the perfect human. That's not true. But if I were, what is the ideal amount of time to have this conversation? Is 3 months okay? Is 6 months okay? Is a year the best thing to do? 2? Like, what's the ideal here for planning a pregnancy?
Yeah, Eritrea, that's a really great question. I think I can't answer it because it depends on the person's circumstances. So this is what I would say. We would optimally want the A1C to be under 6.5% at the start of the pregnancy, but under 6% is even better. But that doesn't mean just having that A1C at goal. We don't want excursions up to 200, 250. We want to also control the glucose variability over the course of the day. We don't want to be on any medications that can harm the baby. We don't want to be using any outside things that can harm the baby, like tobacco products or other substances like cocaine or drugs, right? So if someone has their A1C at goal, is not having postprandial glucose excursions, is not on medications that would hurt the baby, is already taking the prenatal vitamin, is already using the technologies that we recommend in pregnancy, for example, a continuous glucose monitor, CGM. If that being said, they have their weight at the optimal weight, like all these things taken into account, then they don't need that much time, right? If someone else, on the other hand, is having some struggles with something that's related to one of those things that I just mentioned or something else, maybe they need 3 months, maybe they need 6 months, maybe they need a year to sort of get things in order before they try to conceive. We are in the era of individualized medicine, and we should keep that in mind. We can't treat every person the same as the next person. So every person's circumstances will dictate what is that optimal amount of time that they need to prepare for the pregnancy.
That tells me everything I need to know. Thank you. So the more time, the better. Basically, the minute you start thinking about it, go do something about it. Talk to your doctor.
Yeah,
I mean,
I think, is there any harm in going in like a year ahead of time if you're really ready to start now? No, absolutely not. So yeah, have that conversation a year beforehand, and maybe you and your provider say, hey, things are actually looking good. As far as I'm concerned, you can go ahead and try whenever you want, versus like, I have some work to do. If you don't know, go in a year ahead of time. I think that's a good plan.
for a partner, spouse, mom, family member who is supporting a person who has diabetes during that pre-pregnancy stage and throughout the pregnancy, what does that support really look like for them?
Yeah. So here's kind of how I think about it. I'm not a pediatrician, but pediatricians care for the person with diabetes and the person's family in a sense, right? Everyone is involved to a degree. And pregnancy is a very vulnerable time in someone's life, and it can be stressful for a lot of individuals. And many research studies have shown that, individuals who are carrying a pregnancy who have diabetes feel a tremendous burden and stress. So for someone else who's a loved one of that person, I think there's a few things to keep in mind. Ask the person who's pregnant, hey, how can I help you? That's the first thing. Second thing, there are sort of extreme glucose levels that we get very concerned about in pregnancy. So women with diabetes can have a severe hypoglycemic event at any stage in pregnancy, but particularly in the first trimester. What I mean by a severe hypoglycemic event is that they have loss of consciousness, confusion, seizure. For some reason, that person cannot take care of that low glucose alone, needs the help of a third party, someone to give them juice or give them glucagon or whatever it is that may be. So people around that pregnant person should know how to use a glucagon kit. You should make sure you have an active, unexpired glucagon kit at home. Second thing, we worry a lot about diabetic ketoacidosis in pregnancy. That can occur at an elevated glucose, but not as elevated as outside of pregnancy. So some people call it euglycemic DKA. It's not actually a normal glucose, but outside of pregnancy, maybe someone has DKA at glucose level of 400, 500. In pregnancy, this can happen at 250 or 300. That can threaten the life of the mother and the child. So have active unexpired ketone test strips at home. And if you're supporting that person, and make sure that person is hydrating, is calling the provider, is deciding should I go into the hospital or can I manage this at home with the help of my provider over the phone? What is the circumstance and how seriously do we need to take this? Always take it seriously, but is this at the level that we need to go to the hospital, or can we work on this together? I think the other thing that can happen is it's really helpful, if it's not too cumbersome for the relationship, to share CGM data with somebody else. So, in that sense, like if somebody's having a low glucose trend and somebody else is getting that alert, that person can call the pregnant person. Hey, how are you doing? I just saw your glucose is trending down. Are you okay? Do you need something? Or I just saw your glucose level went to 30 and I got to learn on my phone what's going on. To just sort of be that extra person and relieve some of the fear of hypoglycemia, because that there's always a backup for you there. So I think those are some of the ways that you can support that person. And then, it can be uncomfortable. Pregnancy can be uncomfortable. It's a beautiful time, but it can be physically uncomfortable in a lot of ways. So just helping them in whatever that means. Hey, your legs are kind of swollen. Let me grab a little step stool here so you can elevate them. Or I see that you're having trouble sleeping at night. Let's talk to your doctor about that. Is there something we can do to help you with that? Sometimes that person is so concerned with the glucose that they're forgetting other parts of the pregnancy that need to be addressed. So that support system can help them with that as well.